Yeah, our emergency departments and EMS system right now are incredibly busy. We have staffing shortages. We have increased volume of 911 calls for the ambulance. We also have testing is challenging. And so we really don't want people to go to the emergency department or use 911 unless they're having an emergency or a really urgent condition that prevents them from getting there some other means. So we don't want to discourage it, but we also want people to be judicious with it. We have extensive waiting times in all the area emergency departments. We have staffing shortages with both EMS and in-hospital. And so trying not to burden the healthcare system with asymptomatic or very mild illness is just another thing that the public can do to help us out. We are seeing a number of people in the emergency departments who say they have been exposed to COVID, and they're coming to the ED because they don't have access to a test and they want to know if they've got it. And so it's basically kind of a fear-based visit to the ED. They have no symptoms, they're otherwise healthy, and they're coming to the emergency department to get a test because they're concerned. So I think we do need to address the fear factor. And I think it's reasonable to say that most people aren't going to die from COVID. Most people aren't going to be hospitalized. And so having an exposure to COVID heightens your awareness to look for symptoms and to keep yourself safe. But at the same time, you don't need to go to the emergency department if you're asymptomatic and just looking for testing out of concern. So I would seek testing elsewhere at the other sites throughout the county and in the region that offer testing. And again, the asymptomatic nature of it, we just really don't want to burden the emergency departments with folks who are looking for testing and are just concerned that they might have it. We really want to conserve our resources for the heart attacks, the strokes, the traumas, so we can keep those resources intact for the sick folks. We really encourage people to call 911 and to use the 911 system judiciously. I mean, we never want to discourage someone from calling 911, but if you have trouble breathing, you can't catch your breath, you're panting, you're gasping, you can't talk in full sentences, that would be an indication to call 911. Anytime you're concerned about chest pain, chest discomfort, and you're concerned about a heart attack, that would be a time to call 911. If your family or loved one is confused, they have what we call altered mental status, they're not behaving normally, they're less responsive than normal, also a good indication to call 911. Those are some high risk areas where we really want people to seek out emergency care. Otherwise, asymptomatic folks who know they're positive and don't have symptoms don't need to seek care in an emergency department or call 911. Mild symptoms can be treated at home frequently. So oftentimes ibuprofen, Tylenol, salt water gargles, throat lozenges, over-the-counter medicines that just help treat the symptoms are very reasonable for much of the population if they have COVID. Common symptoms of COVID are similar to other upper respiratory tract infections. One of the most common things is fever, headache, body aches, chills, sore throat, scratchy throat, cough. Some people get nausea, vomiting, or diarrhea. It depends. So there are some GI symptoms in some folks. People frequently lose their taste and also their sense of smell. But depending on the variant, sometimes they have different symptoms. But most of them, fever, body aches, cough, sore throat, those are pretty ubiquitous and everybody kind of seems to have those symptoms. If you have risk factors, and by risk factors I mean morbid obesity, high blood pressure, heart disease, lung disease, organ transplants, on chemotherapy, cancer patients, kidney disease, people on dialysis, those are the highest risk groups for severe illness and death in COVID. And those folks need to be a little bit more cautious when we're talking about seeking out medical care. But for a large majority of the patients who are not at extremes of age, who don't have underlying risk factors like we talked about, you can manage these symptoms very well at home by staying hydrated, doing your things like ibuprofen, Tylenol, and over-the-counter remedies to just make yourself feel better while you get better. And so I think it's reasonable to give that a college effort, if you will, to try to avoid overburdening the emergency departments with unnecessary visits for mild disease. If you have access to primary care, calling your primary care physician is one of the first steps. Second, there are many urgent care and other alternative care sites around the county and in the community that aren't the emergency department. So those are some quick things that you can do. If you have access to the internet, Googling WebMD, Medline, all these kind of resources that can help you navigate mild symptoms and signs and symptoms of when to call 911 or when to go to the emergency department. So I would seek out those resources before just running to the emergency department because you have a positive test, for instance.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to an e-newsletter with the latest data and precautions being taken in the county and state.